This right here is a pressure point I use. It's that soft tissue right above the eye. There's like a little dimple there, and if you press it and you move up, really help you. Now right there, I'm giving her a little bit of traction because why not? Let her body do some of the work. I'm pinning those scalenes, my chest is high, and then I'm just using her body. Hi there. Let's do some deep, specific body work in a way that does not stress our bodies out. Come on. So, my beloved client is in her 80s, and she really likes deep tissue massage, and she has a pretty good hip injury. And so I'm going to start with her head and neck. Nice little tension. Notice how straight my arms are. Notice that my thumbs are up. And notice that when I'm doing traction, I'm leaning back. I am not flexing my fingers to get those suboccipitals. I'm just warming up. Now I'm going to find those deeper trigger points and knots. And notice that my knee is near the table and my knuckles are actually going into that fossa. I'm kind of following her neck down and I'm finding areas of tension. And I'm going super slow and I'm rocking my whole body. This is a full body massage for practitioners too. Okay. I am never, ever, ever, ever going to use my thumbs in the neck. It's just not going to happen. Now this client, I love it because she's always so curious as to what I'm doing. So I totally geek out on anatomy. Notice that my shoulders are back, giving my shoulders a little back roll. Now right here, I'm on her temporalis. What's so amazing about working the temporalis is it doesn't take very much pressure. I'm just working a little bit of those attachment sites. And now I'm going to find her suboccipitals. I'm going to go in straight. Okay, my arms are straight. I'm behind her transverse processes, above her spinous processes. And I'm just feeling around. There's no deep tissue. You'll notice I don't have the best body mechanics there, but I'm not doing anything deep. I'm just finding. You could find the mastoid process, just go inferior that, just, inside that lamina groove, all that tissue right there, that whole tissue just posterior, those transverse processes is great. That's her mastoid process. Yep. And I'm using my knuckle and I'm just going just below her mastoid process. And I'm really just pushing back into her directly underneath her T transverse processes. There's a hornet's nest of all kind of activity here, just from living a life, from sitting, from driving, from living, from screen time. And I'm accessing about two of the suboccipitals right there, a little bit of the attachment site of splenius capitis, all that fascia and connective tissue that often thickens in this area because we're so flexed forward all the time. And I'm just, notice how stacked my joints are. I'm coming in straight. Now right there, I'm giving her a little bit of traction because why not? Let her body do some of the work. I'm pinning those scalenes, my chest is high, and then I'm just using her body to stretch those scalenes. Scalenes are some of the most important muscles in the neck to work. They often have incredible referral pain that go actually into the face and upper jaw. This right here is a pressure point I use. It's that soft tissue right above the eye. There's like a little dimple there, and if you press it and you move up, really help you. Now notice here, I'm just below inferior edge of the zygomatic arch. That is such a great pressure point to work. If you have them open their mouth and you kind of press in and then just soften and close it, then it feels amazing because you're getting that tendon of the temporalis. Really good for facial massages. Anybody with TMJ, that tendon really does need to be worked. Little scalp massage, because why not? It doesn't do anything. It's not hard to give. Now, I'm not doing deep pressure there. I'm touching things. I'm flexing my fingers just to touch things and to grip things, but I'm not doing any deep downward pressure. She's asking me what I'm doing and why does it feel so good, and why does it hurt? And I find the more you can educate your clients, the better. If they want to know. Obviously, if they just want to be quiet, then just be quiet. But a lot of people want to know what you're doing and why. And I think it really adds to credibility, really adds to, oh, they know what they're doing. So again, you can't see it great in this angle, but my shoulders are back and I'm really moving my whole body up and back. It's kind of like a core workout versus just an arm workout. This should really be your rest time. This should always be your rest time. This is such a nice little move. All you do is straighten your arm. Almost no pressure on that edge right there. And then just straighten your elbow. This is a little neck traction. Obviously, if somebody has a neck fusion or something, you're not going to do it. But otherwise, go for it. I always tell them to pretend they're like a cooked noodle. Make sure you don't grab their ear. I'm just kind of giving her a little traction and then pulling up. Thank you for watching. You stayed to the end. What else do you want to see? Please comment below. Really helps the channel. My tiny little baby bodywork channel, yeah.